and welcome to our Chronic Disease Day webinar on nutrition, obesity, and chronic disease prevention. My name is Randy Odabrowski, and I'm the Chief Operating Officer at Good Days. For those of you who may not be familiar with our nonprofit, we're a charitable foundation established in 2003 that has provided more than 2 million grants and distributed over $3 billion in assistance to help people get access to the healthcare treatments they need. Good Days also established and leads the annual Chronic Disease Day campaign. Thank you for joining us for our second webinar of 2024, as we look forward to our in-person events in Dallas, Texas, and Washington, D.C. in July. Today, we have a very special lineup of guest speakers, including Dr. Andrew Bremer, Director of the Office of Nutrition Research at the National Institutes of Health. Also joining us are U.S. Representatives Marina Miller-Meeks and Brad Winstrup. But first, it is my pleasure to welcome to the stage Clorinda Wally, the President and CEO of Good Days, for an interview with Dr. Dariush Mozaffarian, cardiologist, public health scientist, and director of the Food is Medicine Institute at Tufts University.
Thank you, Randy. And thank you, Dr. Mozaffarian, for being here and sharing your important information that we have, not only on nutrition, but in how it relates to chronic disease prevention. So let us go ahead and get started. Can you give us a brief overview of the Food is Medicine Institute and its primary mission?
Of course, and first, thank you to you, Clorinda, and to Randy for all the great work you and your team are doing at Good Days. It's so important for the country to focus on chronic disease. We are in a chronic disease epidemic, and this epidemic really started in our adult lifetimes. I graduated from college, went to medical school in 1991. We didn't have a chronic disease epidemic, certainly not around obesity and type 2 diabetes, even in 1991. And so this is very new, and that means it's fixable. And if we want to fix it, there's many causes, but the top cause is nutrition. And so we have launched a new institute at Tufts, the Food is Medicine Institute, which is really thinking about how to bring food-based nutritional interventions into healthcare. Things like produce prescriptions, grocery prescriptions, medically tailored meals, and also how to use and leverage the federal nutrition programs like SNAP and WIC and school meals, and how to have supportive population policies that all work together. But at the core, the Food is Medicine Institute is about the research, the translation with the healthcare sector, the policy and advocacy with the government to really push forward food is medicine in healthcare. Because as a cardiologist, it's always been sort of my driving passion and kind of my shame that the healthcare system isn't paying attention to the top cause of poor health, which is food.
And you're absolutely right. It is an epidemic. And, I think that if we don't start now, it's just going to get increasingly worse. So I'm going to go on to the next question. Can you tell us, how does nutrition play a role in preventing chronic diseases, and what evidence supports the food is medicine approach?
Yeah, we've known for decades that nutrition is important for chronic disease, but we've always had a little bit of a narrow view of food and nutrition. And so in the 80s, we were focused on heart attacks and lowering blood cholesterol, and that led to a real focus on fat and lowering fat, which wasn't very helpful. And today we're so focused on obesity and that we think that calories and maybe sugar are the only things we should focus on, as though obesity is the only problem that nutrition causes. And both of those are really narrow views. Obviously, diet does affect cholesterol and heart attacks and does affect obesity, but food is biologic information. I think this is the missing link to getting this off. Food is the most important biologic information that we take on in our daily lives. Every food we eat has incredibly diverse and complicated and powerful effects on almost every system in our body, from the blood vessels to our inflammatory cells, to our fat cells, to our brain, to our microbiome, our liver, and on and on. And so what Food is Medicine is trying to do is finally leverage that power of healthy food in particular to be powerful biologic information, to be a therapy for disease treatment and even prevention. And it's a couple of really important things I think are exciting about Food is Medicine. First, as I mentioned, this is a therapy. We're not talking about, well, let's eat healthy because 10 years down the line it's going to make a difference. We're talking about patients with cancer, type 2 diabetes, heart failure, end-stage renal disease, other chronic conditions, getting healthy food, and within months, feeling better and even having lower healthcare costs and lower healthcare expenditures. Number two, This also addresses social determinants of health, because food as medicine can also help address food insecurity. Although that's not its primary goal, it can also help address one of the core social determinants of health. And finally, through those two interlinked powerful mechanisms, using food as biologic information and addressing food insecurity, we can finally start to address health inequities. Health inequities have been stable or worsening in the last 30 years, particularly related to poor nutrition and lifestyle. And so, food as medicine is not going to fix everything, but it's one very important tool to address these issues.
No, and coming from someone with a chronic illness, I can tell you it's an autoimmune disease. When I eat better, I feel better. And so, it isn't just about obesity and prevention, but it's also helping your own systems and your own chronic illnesses that are not preventable. You just feel better. And the more you feel better, I think the more active you are, the more productive you are. So I have a question. Can you share some of the key programs and initiatives the Food as Medicine Institute is currently working on to promote chronic disease prevention?
Yeah, we're working first on many randomized controlled trials to try to understand, in a carefully controlled design, how food as medicine works. And so we work a lot, for example, with Kaiser Permanente, and we've completed a trial among patients with diabetes in Southern California, giving them medically tailored grocery boxes once a week, showing that it significantly reduces hemoglobin A1C and significantly improves nutrition security and food security. We're doing a second large trial with Kaiser Permanente across California with Instacart as a partner, where we're giving people what's called fresh funds, where they have a curated list of healthy foods they can choose and themselves, getting $100 a month. Again, looking at outcomes like hemoglobin A1C and also quality of life. We're working on projects both here in Boston and also in Texas with high-risk pregnancy. How can we use food as medicine to help women with high-risk pregnancy have a healthier pregnancy and a healthier baby? We also are working with collaborators in Massachusetts and California in evaluating the Medicaid 1115 waivers in those states, which are these waivers in Medicaid which allow Medicaid programs to pay for food as medicine. And so working with partners here and in California, trying to understand what that can do. We're also working with the National Association of Chain Drugstores. Most Americans go to a drugstore much more frequently than they go to their doctor, particularly if they have a chronic disease. They might be going multiple times a month. Mm-hmm. And yet we're not leveraging the pharmacy as a place to screen for food insecurity, to screen for nutrition insecurity, and to prescribe food as medicine. And so we're doing a project where we're going to use the community pharmacy and hopefully also link that to a pharmacy where there's a grocery store. A lot of pharmacies are in grocery stores. So you get your prescription for healthy food, go right across the hall to the grocery store and get your healthy food. And it's just one more example. We have many other projects. We're also working with Google around health information quality. How do we help create and leverage AI to let people around the world get trusted nutrition information? Because people are really confused about nutrition. So that's just an example. We have about 23 active projects. I think that's an example of about 5 of them. And it's really an amazing movement, across the country now in food as medicine.
And so how do you determine the collaboration? Where does that begin?
Well, I think, we want to first and foremost focus on impact, right? What collaborations can give us the absolute top impact for the most number of people in the US? And also we have some collaborations internationally in Ghana and Australia and Japan. But what's the impact first and foremost? And what's the impact not only on health, but on health equity and also on healthcare costs? We kind of want to have that triple bottom line of thinking about health equity, and also, costs. And so that's the first consideration. And then, what's the key research question, or in the case of our policy work, what's the key policy lever that we really need to push forward? There's a lot of room for policymakers at the state level and at the national level to help move this forward. Governments are not going to solve all the problems. We need the private sector, we need civil society, we need the nonprofits, but governments really have a role to catalyze and streamline and also remove barriers when barriers are present. And so I've been very impressed with the current administration, the Department of Health and Human Services. There's a lot going on around food as medicine. The National Institutes of Health is committed to food as medicine. The VA is launched food as medicine produce prescription pilots. The Indian Health Services has launched those. Secretaries Becerra and Vilsack from Health and Human Services and USDA launched the first inaugural Food as Medicine Summit, just a couple months ago. So there's a lot going on, but I think collaboration, whether it's with policymakers, the healthcare sector, nonprofits, or the healthcare sector, is really essential to get the work done.
I think you just kind of hit on the next question, which is policy and advocacy. And how involved are you all in policy around nutrition into healthcare?
Well, when I arrived at Tufts about a decade ago, I was previously, a faculty member just across the city at Harvard Medical School. And when I came to Tufts, one of the first things I learned about was Jean Mayer, the nutrition scientist who founded the Friedman School, and how in 1969 he helped organize and stimulate the 1969 White House conference on hunger, nutrition, and health that led to so many of our policies around getting enough calories to people, things like expanding school meals and food stamps, the creation of WIC and school breakfast, and so much more. And when I learned about that history, I said, how is it that the last time at the national level we focused on food was 1969? And so I was really pleased that in 2022, the current administration, along with bipartisan leadership in Congress, held the second White House Conference on Hunger, Nutrition, and Health. We helped, along with other collaborators, contribute to that agenda and really kind of continuing to push those themes forward. Our three top priorities, where we think we can really move the needle, are food as medicine and healthcare, advancing nutrition science. We really need to do a lot more in nutrition science, and advancing nutrition security in the federal nutrition programs. I think if we can advance nutrition science, nutrition security, and food as medicine, that will play a big role in starting to turn the tide on chronic disease. And so we're regularly going to DC, talking to congressional offices, trying to work with the agencies, trying to be a resource, trying to be helpful. We have no skin in the game. We don't have any specific ask for Tufts or for Boston or for Massachusetts. We just want to be an advocate for evidence and for healthier lives.
Yeah, and I've read many statistics that indicate that for the first time in many years, our children have a predicted lifespan lower than we do, and it's all related to obesity and the underlying things that it causes. I think that many people don't realize obesity translates into different types of cancer, of course, heart disease. But if we don't start now, I certainly think that it'll continually get worse. So the next question I have is on challenges and solutions. So what are the biggest challenges you face in implementing nutrition-based interventions, and how are you all addressing them?
Well, I want to go back to what you said first. I think so important about highlighting that for the first time in American history, longevity has been going down the last several years, and it's due to many causes, but the rise in chronic diseases is a big part of it. And so our kids today have more than 50% chance of having getting type 2 diabetes in their lifetime, more than 80% chance of being overweight or obese in their lifetime, more than 50% chance of getting cancer in their lifetime. These are just not, it's not okay. This is not the normal human condition to be this sick. In addition, our kids are going to be facing, for the first time in American history, 50% of the federal budget and 50% of state house budgets being on healthcare. Right now, it's 30%. The year I was born, 5% of the federal budget was spent on healthcare. Now it's 30%. And so we're also squeezing out, and it's almost 20% of the whole economy, right? One in every $5. Yes. And so we really have a national nutrition crisis. It's a massive crisis that we're just sort of shrugging collectively. And I say we collectively are shrugging, but the food as medicine movement is starting to shift that. And I think COVID-19 and the war in Ukraine and rising food prices and lots of things have let Americans of all stripes and all states and all regions and all ages and all races and ethnicities realize that the food system is broken and we can fix it. So I think that's really, really important. Now, there's lots of challenges, right? There's lots of challenges. And so, healthcare is really complicated. The rules are so complicated for Medicare, for Medicaid, for other commercial plans, all the regulations to get involved in healthcare. And so there's many both nonprofit and for-profit startups that are trying to get in the food as medicine space and hitting these barriers. And yet at the same time, there's real opportunities here around Medicare Advantage plans and value-based care with ACOs and shared savings programs, Medicaid, 1115 waivers, commercial plans. So I think there's a real opportunities. And interestingly, you mentioned obesity. I'll just briefly say, one of the great opportunities is how do we leverage the power of the Ozempic, Wegovy, GLP-1 agonists for weight loss? How do we leverage them short term to get the weight loss we want, but then get people off them and get them on a lifestyle and food as medicine program to maintain the healthy weight? Because they work for the right patients who can tolerate them and don't have side effects. But once you've been on them for about 18 months, your weight plateaus, and then you have to be on them for life. And many people don't want to be on them for life. And also, we just absolutely can't afford it. And so I think actually that's a challenge and an opportunity to bring together food as medicine with these new GLP-1 agonist weight loss drugs.
Yeah, and I agree. We've always talked a lot about you've got to, movement and activity, but it's really a pair. It's eating well through food as medicine, and being active. And the more your weight is under control, the more active you can be, and it's more of a sustainable lifestyle. So what advice would you give to other nonprofits that are working in the field of patient assistance and chronic disease prevention regarding incorporating nutrition into our programs?
Well, I think one of the first things I'll say is what you said, Clorinda, is when you eat better, not only are you healthier, but you feel better. And I think we've sort of forgotten a little bit about the joy and the energy and the positivity of feeling good, right? We've sort of, as a clinician, we've made it all very clinical, right? Like, okay, you're going to lower your A1C, you're going to lower your blood pressure, you're going to lower your weight, but there's a joy to being healthy and doing it through natural things like sleep and mental stress reduction, exercise, and nutrition. And I've talked to countless patients who tell me on food as medicine programs who receive these produce prescription or grocery prescription or medically tailored meal programs. And they talk about the joy of how they feel eating well, the joy of cooking with their family, of cooking with their children. Cancer patients who are not trying to lose weight, but are trying to gain weight and had felt hopeless because they couldn't find any food they could eat and they could tolerate and they could taste. But once they got on a customized medically tailored meal program, they felt reinvigorated and their life came back. Patients with diabetes who feel hopeless, like this disease is crushing them, crushing their eyesight, their kidneys, their nerves. And yet on a food as medicine program in 6 months kind of felt like they took control over their lives. So I think there's a real joy to healthy lifestyle for chronic disease prevention, which surpasses what you can do with medications or surgeries or devices. And that joy also extends to providers. About 20% of all doctors in our country say they're burned out and may retire and leave the practice of medicine. And I've talked to many doctors who are prescribing food as medicine, and one of them said, I finally feel like the doctor that I wrote about in my personal statement when I applied to medical school. Like, it's bringing joy back to doctors to be able to actually address the core fundamental issues that their patients are facing, rather than kind of a Band-Aid fix with a pill. So I think for nonprofits in this space, I think we got to think about all of these incredible benefits, and then look for state advocacy coalitions, look for healthcare partners, read about what's happening. There's a national produce prescription collaborative. That's a collaborative of produce prescription providers. There's a food as medicine coalition. That's a collective of medically tailored meal providers. Both of those are excellent assets for getting involved in this space.
Well, thank you so much for that. I think, again, the Instacart thing is beautiful. So there's many people who don't have transportation. So that's just another way to alleviate the burden of one, not having access, but to the provision of it. So thank you. Any final thoughts for our audience?
Well, I think, I want to just highlight one, that we're truly in a national nutrition crisis and a chronic disease crisis, and that this is fixable, right? It doesn't all have to be doom and gloom. This has happened really since 1990, right? The last, 34 years or so. And we can turn it around in 10 or 15 years with smart policy, smart private sector innovation, smart science, smart, nonprofit advocacy. So this is not, an inevitable decline into ever spiraling chronic disease and healthcare spending and health inequities. We can reverse that. And one of the core ways to do it is through healthy eating and food as medicine.
Well, thank you so much for your expertise, and we really do appreciate you joining us today.
Yeah, a pleasure, and thank you for all that you do.
Absolutely. Take care. Next up, please stay tuned for a presentation by Dr. Andrew Bremer, Director of the Office of Nutrition Research and the National Institutes of Health, followed by remarks from members of Congress Marinette Miller-Meeks and Brad Wenstrup.
Hey, I'm Drew Bremer, and I want to thank the Chronic Disease Days Nutrition and Chronic Disease Prevention webinar organizers for giving me the opportunity to participate in this webinar today. It's such a privilege to join you. Today, I was asked to say a few words about the Office of Nutrition Research here at the NIH and how patient advocates, the public, and medical professionals can support and amplify the work we do, and to keep it short and sweet. So here we go. Who are we? Well, the office is currently a group of 9 folks who come to work every day committed to advancing nutrition science to promote health across the lifespan. And I'll pause here for a bit to take a moment for gratitude, because each of the team members brings their unique lenses and skill sets, and by working together, the whole of the office is definitely more than just the sum of its parts. And where does the office sit? Well, the office sits in the office of the director at the NIH, giving us the unique ability to interact and coordinate with all the 27 institutes and centers. But importantly, our reach also goes beyond the NIH, and it's an honor and privilege to have collaborative interactions with many federal agencies and departments, including the USDA, the FDA, the CDC, USAID, the White House, and many others. We may be different agencies, but we're part of one government, and there's currently tremendous interest in the nutrition space, and that is super exciting. So, what is our mission? Well, the mission of the office is to advance nutrition science to promote health across the lifespan, and to support the development of evidence-based, equitable, context-specific, culturally appropriate, resilient, and sustainable solutions to reduce the burdens of diet-related diseases and health disparities. And yes, I recognize that there are a lot of adjectives in that sentence, but each one of them is super important. And what are our guiding principles? Well, nutrition is not the same as food. Yes, food is a delivery mechanism for nutrients and bioactives, but nutrition encompasses so much more. It's what the body does to the food, and what the food and metabolites do to the body, and how that affects health. Nutrition connects the food we eat to our overall health. Nutrition also touches every cell and every system in our bodies, at every age and stage throughout the lifespan. Nutritional status is also both an input and an outcome of health and disease. Furthermore, nutrition is disease agnostic, and it's important for every person, every family, every society, and the planet. What is our conceptual framework? Well, that food systems, planetary health, and human health are all interconnected and all have reciprocal relationships. Why do we care so much? Well, the US and indeed the whole world are facing an urgent nutrition-related health crisis. In the US specifically, suboptimal nutrition is threatening our public health, economy, and national security, and is estimated to lead to the death of approximately 15,000 Americans each week. Moreover, the combined healthcare spending and lost productivity from suboptimal diets cost the US economy greater than $1.1 trillion per year. Suboptimal diets are also responsible for more deaths globally than any other risk factor, including air pollution, tobacco smoking, and high blood pressure. And to put everything into context, as many Americans die each year from diet-related illnesses as died during the entire American Civil War and World War II combined. Well, I do admit that I'm a Simon Sinek fan, and I really appreciated reading his book, Start With Why, and the concept of the Golden Circle. So what is our why? Our why is to lead the NIH in stimulating solution-oriented research to address key elements of the domestic and global nutrition enterprise, so that there is an evidence base to support the implementation of context-specific, equitable, culturally appropriate, resilient, and sustainable solutions addressing priority diet, nutrition, and health challenges. What is our how? Well, appreciating nutrition as part of a holistic ecosystem and adopting the conceptual framework of a nutritional ecology, which appreciates humans as complex biological systems affected by both internal factors, for example, biology, genetics, health context, and developmental stage, as well as external factors, for example, household, community, school, physical, and environmental factors. And expanding the study of nutrition beyond a reductionist approach focused on single nutrients to that of the nutriome and food patterns. And using this ecological framework, appreciating nutrition and nutritional status as one, a fundamental biological variable, like age and sex. Two, both an input and an outcome of health and disease. And three, the operational measure of the advocacy of the diet to support health and the result of a series of reciprocal processes, including ingestion, digestion, absorption, metabolism, transport, homeostatic regulation, and elimination, involved in acquiring and using the required dietary substances and nutrients to support the growth, repair, and maintenance of the body. As such, nutrition is not limited to only an understanding of food and exposure scenarios. Rather, its assessment must include a full appreciation of its overall ecology and all the factors that influence those environments. And what is our what? Well, to engage the full continuum of effort at the NIH and across the entire US government to advance nutrition science from a translational perspective. To coordinate the development of a national nutrition science strategy to identify and support research that is actionable, inclusive, equitable, and scalable to improve the nutritional status for everyone across the lifespan and mitigate the health impacts and burdens of diet-related diseases and health disparities, and in so doing coordinate and promote the equitable translation of nutrition science discovery to clinical practice, and to improve our precision of nutritional assessment and attribution, and in so doing improve our understanding of the role of nutrition in health promotion, disease prevention, and treatment, which will be necessary to optimize food as medicine and precision nutrition efforts across the country and globe. What is our goal? To support rigorous nutrition science research to provide the evidence base to inform clinical care, to have the nutrition science research inform the evidence base to inform clinical care, and to have that circle continue. Our goal is for research not to stop at discovery, but to be translated into action, to support research that isn't just publishable, but also solution-oriented and actionable. So, what are some of the activities that we're engaged in? Just a few of them are highlighted on this slide, and some of our high priority ongoing activities include enhancing and implementing the 2020 to 2030 strategic plan for NIH nutrition research, as well as continuing our efforts in the Nutrition for Precision Health, powered by the All of Us research program, which was recently highlighted on Good Morning America. In addition, we're engaged in research activities in the following areas: enhancing the precision of nutritional assessment and attribution, food as medicine research, nutrition regulatory science, particularly with our colleagues at the FDA, and research on the reciprocal relationships between nutrition, food systems, health, and climate and environmental changes. And it is in all these activities that patient advocates, the public, and medical professionals can support and amplify the work that the office does. Where are we going? The future of nutrition is bright and exciting. And in addition to moving the nutrition science field forward, we at the Office of Nutrition Research are also committed to training, expanding, and diversifying the next generation of the nutrition science workforce. I'll wrap up now and once again say thank you for the generous offer to participate in this webinar today. I also encourage everyone to stay connected to our office and its activities through our listserv. With that, I'll keep to my time and wish you all the best. Stay safe, be well, and thank you again.
Hello, I'm Congressman Brad Wenstrup, representing Southern Ohio. Thank you for inviting me to speak to you during your Nutrition and Chronic Disease Prevention webinar, and for this opportunity to address you virtually on Chronic Disease Day. As a physician and a member of the House Ways and Means Committee and our Health Subcommittee, I'm focused on making sure patients are at the center of healthcare policy. I've made it my mission here in Congress, and I'm grateful to all of you for the work that you do advocating for patients. I'm also co-chair of the GOP Doctors Caucus, a group of 20 of us in the House that came to Congress after a career in medicine. The Doctors Caucus is committed to using our real-world experience as healthcare providers and policymakers to help make America the healthiest nation on the planet. As a physician, the prevalence of obesity in our country deeply concerns me. 4 out of 10 American adults live with obesity, and the incidence of obesity is rising. Obesity is linked to about 300,000 deaths annually. According to the CDC, obesity is prevalent in over 40% of adults aged 60 and older. The NIH attributes obesity as a cause of increased risk for many additional health problems, as I'm sure you know, such as type 2 diabetes, high blood pressure, heart disease, stroke, liver disease, and certain cancers, as well as contributing to many orthopedic conditions. We need to keep Americans healthier for longer, and when patients go without obesity treatment, which is multifaceted for sure, it's more difficult to treat later down the line. We have to stop stigmatizing people and start making treatment available to patients. We should stigmatize the idea of saying that we have a problem with obesity. That's why I introduced the bipartisan bill, the Treat and Reduce Obesity Act. This Congress, I was proud to reintroduce this legislation with fellow Dr. Raul Ruiz. This bill would allow Medicare to cover treatments approved by the Food and Drug Administration for obesity. Access to treatment not only improves outcomes for patients, but also reduces the cost of care for future conditions that co-occur with obesity, such as heart disease and renal disease and diabetes, as we mentioned. By tackling obesity head-on, we can help lengthen Americans' health spans while also saving taxpayer dollars over the long run. The cost of medicine is high. Let's try to reduce what's needed by being out ahead of the game. So as I enter my final year in Congress, I'm pleased to see this bill has a growing list of co-sponsors. It's garnering a lot of support and gaining more traction than ever before. I believe it's important that we help better educate people on the impact of dangerous health choices and that we teach kids healthy habits. By connecting early to teach and provide opportunities for both good nutrition and exercise habits, we can make America a healthier nation and prevent many long-term healthcare problems associated with obesity in particular. I'm grateful to all of you for participating in this webinar today and for the advocacy, resources, and assistance the national nonprofit Good Days provides for patients with chronic illnesses. I'd like to thank President and CEO Clorinda Wally for leading this organization and the awareness provided to the public and to Congress. I'm eager to continue to work with you on passing important healthcare legislation as we work to, again, make America the healthiest nation on the planet. Thank you again for participating today and continue the good work. God bless you.
Hello, I'm Congresswoman Marionette Miller-Meeks. I'm proud to represent Iowa's 1st Congressional District in Washington. As a physician in Congress and the former director of the Iowa Department of Public Health, I understand how critical it is to ensure quality care and access, which includes robust chronic disease research and funding. As we know, some of the deadliest and costliest chronic diseases are also the most preventable, and yet chronic diseases accounting for 7 of the top 10 causes of death in America and more than 90% of our annual healthcare spending. Regrettably, Medicare beneficiaries lack access to person-centered obesity interventions across the continuum of needed care. This is due to Medicare rules limiting care to in-office settings and restrictions on healthcare providers. In fact, registered dietitian, clinical psychologists, and specialty physicians are prohibited from delivering care. Furthermore, Medicare currently prohibits access to approved FDA medications to treat obesity, while other agencies, such as the VA, provide enhanced standards to treat obesity. Medicare is an outlier. That is unacceptable, and Congress must act to bring Medicare to updated standards of care. That's why I'm proud to join you all as a champion for the Treat and Reduce Obesity Act to cut through the red tape and increase options for Medicare beneficiaries battling obesity. In Congress, I will continue to fight to slash bureaucratic restrictions and deliver more options for healthcare providers and patients. Thank you all for the important work you are doing for those suffering from chronic diseases. Together, we will make great progress to lower the rate of preventable chronic diseases.
Thank you to our wonderful speakers for joining us today. This was a lot of great and timely information. If interested in reviewing Dr. Bremer's slides more closely, they will be available on the Chronic Disease Day website. Thank you for everyone tuning in. We hope that you found today's program useful and look forward to recognizing Chronic Disease Day together this July 10th. Please visit chronicdiseaseday.org to learn more about this year's campaign, as well as our upcoming Leadership Summit in Dallas and Congressional Luncheon in Washington, D.C. Thank you again, and have a great day.